Hi again, welcome to our condition of the week. And this week's condition is really the little brother of back pain and neck pain, and it's mid-back pain, which really is just as prevalent as the lower back and neck issues that we see in the office. And we have great results with this because most of these conditions are structural again as well. The problem with the mid-back is that it has kind of a unique, it's kind of a transitional area between the low back and the neck, so it's put under some transitional stresses. And also it has the ribs that articulate with it, so there are some unique problems that develop in this area. And I want to cover a few of those for you just briefly here. The first condition I want to talk about is that tension and tightness between the shoulder blades. I've been in practice 35 years, and the first people I saw with this were a lot of the secretaries typing all day long. So these shoulder blades actually are the base that your arm works from, so they have to be stabilized by these muscles that come from the side of the spine out to your scapula, your shoulder blade. So when your arms work, right, they can work from that area. Now, this area tends to get very tense and tight with people that are doing a lot of computer work, that kind of thing. Now, in this day and age, actually, we're getting into a lot of one-sided stuff where they're doing a lot of mousing. So what's happening is it's not just tension and tightness, but the muscles are developing more on one side because it's more of a one-sided activity. And so the vertebrae start to get pulled to that side, so it can actually cause the subluxations in that region. One-sided sports can do this as well. Playing golf or playing tennis, that kind of thing, are going to tend to build up muscles on one side or the other. That's why we recommend when people, the solution here is to get the adjustments to try to correct the alignment issues in there, get the vertebrae back in position and moving well. But we also have to start building up the muscles on the weaker side to help to pull it back that way as well. And then get into bilateral exercises like cross-country skiing or swimming, where you're working the muscles on both sides of your spine equally to maintain that proper alignment. Another issue that develops is something called a painful dorsal spot. Sometimes the pain isn't just a kind of a tension and tightness there. There's actually very sharp, kind of about the size of a loonie, kind of a pain that you'll develop in just off to the one side of your spine. And that's not caused by problems in this area. It's usually because of misalignment or degenerative change in this lower part of your neck. The nerves from this region of your neck innervate the superficial tissues of your upper back, so you'll get the referred pain back or down into the upper back, and it can be quite painful often. The other thing that can happen is that the muscles tend to go down every 6 segments. So if you have a misalignment in your lower neck, it starts to irritate the muscle up there. The muscle just doesn't spasm up in the neck, the whole muscle spasms. So it has a tendency to pull on the vertebra or the ribs down here where it's attaching, and it can cause them to shift out of position and lead to the subluxations or the pain. So the solution there is to work with the neck, try to get the curve back into the neck, get the alignment proper, get the movement better through there, take the irritation from the nerve and the muscle in that region so that the upper back settles down. And speaking of ribs, what happens with ribs now? Ribs can subluxate or get shifted out of position. They actually articulate with the vertebra. There's a little process called the transverse process that comes out the side of the vertebra. The rib comes around from the front and butts up against the spine and the transverse process. So when you have a bad cough or a sneeze or a sudden twisting injury, the rib can get subluxated out of position. Now at first it might just feel a little kinked in there, but understand that your ribs are like a bellows. When you breathe, they tend to expand up and out to bring the air in, and then down and in to push the air out again. So there's a constant movement of that, where that rib is articulating with the vertebra. Now if it's not sitting properly, it's kind of like walking around on your ankle. If it was, twisted off to one side, it's going to get pretty irritated in there after a while, isn't it? So that area, usually with the ribs, it's just a matter of doing a simple adjustment, trying to reposition that, nice gentle adjustment, put the rib back into position, get it articulating properly, get some ice on it, a few adjustments, and things are settled right down there. Other conditions with the mid-back, you've got the dowager's hump. That's something that occurs because of that forward head posture. It's not a growth, but the dowager's hump, that increased kind of a bump that develops in the top of the back when you got that rounded shoulders, is really just these prominent spinuses becoming more apparent because they're not getting sitting under the neck anymore. They're kind of getting pushed back out like that. So it's not a growth, it's a postural distortion. The other condition we have to consider is the position of the mid-back between the low back. We talked about if your hip is low, how the low back is going to lean to one side, compensate back in for balance, and then the neck is going to curve back in to get level, get the head level again. So you can see the severe stress on this middle part of your back because of it trying to be the transition layer between all this distortion. It can lead to subluxations and a lot of discomfort in this area. It's got to be corrected as well. The key there obviously is to get the pelvis level, get the low back straightened out, the neck leveled off, and then the low back, the mid back can actually stay in position for you. With car accidents, the vertebrae in the mid back can be subluxated just like the neck and the low back from all the different traumas we talked about in previous videos. Car accidents, so often you've got the seat belt that goes across, so when you have that sudden jolt, your one shoulder that's not being held back will move forward slightly and kind of cause that twisting through the middle part of your back. It's interesting to note that the mid part of the back is where the nerves go to your stomach, and one of the major symptoms after a car accident for patients is heartburn. So these nerves being, if that area in the mid back is subluxated, does that make sense? That's why that nerve is getting irritated, the stomach's getting overactive, and you're developing the heartburn. Often it's just a matter of correcting the alignment in here, and the heartburn will settle right down. Other issues with misalignments in the mid back, the upper part, again, just like the lower neck, the upper back involves innervation to your heart and your lungs, so we'll deal with issues with the breathing difficulties or heart arrhythmias, that kind of thing. Adjustments in here can be very beneficial if there are issues there. The lower part of the thoracic spine, then right down at the base of the ribs, those are the nerves that go to your adrenal glands and your kidneys. So here, if you have misalignment, you could be getting into things like allergies or asthma, water retention, fatigue, all these other type of issues. And another thing that's out there fairly prevalent these days is the shingles, where people are getting the infection of the nerve and by the herpes virus, and it will cause pretty severe rash and itching and pain in that area because it's really attacking a weakened nerve. So does it make sense to you that if your spine is subluxated and putting pressure on one of these nerve roots, that it's going to weaken that nerve, it's going to get into a less state of health, and so that's more likely the nerve that's going to develop the shingles. So if we can keep your spine lined up, keep the pressure off those nerves, keep them healthy, there's a pretty good chance that you're not going to jump into that and end up with the shingles down the road. Okay, I want to thank you for watching again. Hopefully that's some valuable information for you again. Please share on your social media with your family and friends, and we'll look forward to seeing you next week with our next condition of the week. Thanks for watching.